Come on in. Come on in. Marcus, how you doing?
I'm good. How about you?
I'm all right. How's your week been since our last session?
I don't know. It's been all over the place.
All over the place? Okay. Remember from our last session, I said I want to start each session with regulating our body, not just for you, but for me too, right? Because when we start any session, I like to just start from a place of being calm. So we're just gonna do one revolution, okay? Remember what we did? Okay, well let's calm our bodies just for a little bit, okay? So we're gonna do remember the box breathing?
No.
Okay, so what that was, we took a deep breath in, held it for 4 seconds, exhaled it for 4 seconds, and we did that like 4 times, okay?
So you want me to do that now?
Yeah, we're gonna do it together. Okay?
Alright.
So let's get it started. So we're gonna take if you want to, you can close your eyes or not, but are you comfortable though? Do you want me to do anything with the lighting?
No.
You sure you need anything?
I'm good.
You good? Okay. Alright, so if you wanna close your eyes or not, it's up to you.
Okay.
But remember when you're in this room, this is your safe place, just for now, okay?
Okay.
Whatever you want to say, you can say. Anything you say between us stays between us, okay? If you say anything that you may want to hurt yourself, I might have to just talk to my supervisor because we want to keep you safe. That's all, okay? So let's take a deep breath in. We're going to hold it for 4. We'll do it together. Ready? Deep breath in. 1, 2, 3, 4, and exhale. 1, 2, 3, 4. Let's do it one more time. Inhale. 1, 2, 3, 4, and exhale. 1, 2, 3, 4. Okay. Do you notice anything different in your body? No?
No.
Still feeling a little anxious from last week?
Yeah.
Okay. All right, well, let's talk about that. If you don't mind, remember, I like to take notes. I know some people don't like to take notes, but I do.
Yeah.
Okay, that just helps me. Are you okay with that?
Yeah.
Okay. All right, so tell me what was going on. I did notice you said the anxiety is still there from last week. So tell me how your week went.
I've just been all over the place. I mean, for me, it's just hard to explain.
Yeah.
I've just been in and out of my feelings. I've been just feeling anxious. I just don't know.
Okay.
I don't know where I'm at.
When you say anxious, what does that mean? What does that feel like for you?
Mixed emotions, if that makes sense.
Okay. Okay.
I'm happy, then I'm sad, and then I'm not sad, and then I'm not happy. My anxiety is just everywhere.
It is?
Yeah.
Okay. Do you think, is it related to anything, or it's just...
Me possibly, being in and out of jail.
Okay.
Maybe that's it. I don't know, and just living in just this, I feel like it's a new world, society.
That's a lot. I mean, just being in jail one time is a lot for anybody to deal with.
Oh man, you should have caught me when I got into the police car. I just thought it was over then. I don't know.
Yeah. When you say over there, what does that mean?
I don't want to go to jail.
Okay.
So just being handcuffed and arrested, in that moment, I just, just everything in me was just all over the place.
I can only imagine that's overwhelming. That's more than overwhelming, right?
Yeah.
Yeah.
Could you imagine being in a cell and you're being diabetic and you gotta use the restroom every 20 minutes in front of a bunch of people? And I don't. Everyone, it's traumatized me.
Okay. It traumatized you.
It did.
So, just that alone, and I have a feeling when you're talking about your anxiety and your traumatization, I wonder if there's more behind that, right? But what I want to remind you is that we don't have to get into it. I want to go at your pace when we talk about this stuff. So if anything is too much, you don't have to talk about it. We'll get there, okay? But I wonder, when you talk about your trauma, I myself wonder how you survived it, right? Just to go into jail the one time. And has there been more than once?
It's been more than once, and I don't even know if I survived it. I know that I lived just one day at a time, but have I survived it is a huge question for me. I'm not sure if I've ever survived it or if I ever dealt with it.
Okay. Well, one thing I can see is you're sitting in front of me right now. So you have survived it, right?
Mm-hmm.
You're sitting right here right now. You have survived it. Now, is there something else you want to work on? Yeah, because that's why you came, right? You want to work on your anxiety, but you have survived it. So I want to give that back to you right now. That's called strength and resiliency, right?
Right.
So no matter where you've been, in the back of that car, the police car, you still had that with you, that strength.
Yeah, but I'm in and out of inpatient psych facilities. I've been in and out of Jackson Community Mental Health Center.
Yeah.
A number of times, and I'm just like afraid of how people would look at me.
Okay.
Like I feel like nobody likes me. I don't know. I feel like people have a misconception of me, and just getting in trouble just that one time just changed the whole trajectory of just my well-being, just me.
Okay.
And I feel like I've lost myself.
Okay, so let me ask you, when you said that you feel that people don't like you, you feel that people are judging you, and based on that change your trajectory, right? And you've been in and out of the CSU. Number one, okay, in and out of the CSU, that's psych wards. That's a lot too. So we've identified that you've been in and out of jail, right?
Mm-hmm.
In and out of the psych ward. Those two things together are a tremendous amount for anybody to deal with, okay? So I want to acknowledge that. And then you said that based on that, you feel people are judging you. But let me ask you, what evidence do you have that they are? And they may very well be, but how do you see that for yourself?
The way they look at me,
the way
that people look at me, the way that they talk to me is, I mean, I don't care what I've done in life. There's no way that people should treat people the way that they do.
Okay, I get that. And so when you say that they are treating you this way and the way they look at you, how is that? What does that make you feel like?
It makes me feel like I'm not a human. It just makes me feel like I'm not a human, and I am human. And I just don't like the way that I'm treated, the way that I'm looked at, the way that I'm talked to, and this hasn't always been me. Ever since I've started coming to this facility, y'all put me on these medications, and then my mind is just kind of like everywhere. I've been losing it. I'm having thoughts at times, and then I'm not having thoughts, and I'm just over it. I'm over feeling judged.
Yeah. Okay. So when people are judging you and you have these feelings of, it sounds to me that when you say you're over feeling judged, I just want to understand what's happening, what that feeling really is, right? So what can you describe to me what that feeling is when people are judging you?
It's weird. I don't know. Only me and that person knows.
Okay.
You know, so if I feel like you're looking at me weird, or if you're talking to me weird, it's just the energy. I don't know how to describe it. It's just the energy.
Is it anger?
I mean, initially I don't feel anger.
Okay.
You know, I mean, at some point I do, you know, because I think about it hindsight, and I'm like, wait a minute, why did you look at me that way? Why are you talking to me that way? Like, I'm not your child.
Right. Okay. And has this happened more than once?
Yes, it happens all the time that I come to this psych hospital, and it's like, I don't know, it just happens all the time. And then even when I go back and forth to jail, the correctional officers, they're looking at me a certain kind of way. They equate everybody who comes to jail just to be the same as that person. They don't have empathy for you, and I'm just sick of just being and feeling judged. They yell at you when they talking to you, even when it's, time for you to get, released from jail. It's always inmate, and they're yelling, and I'm just sick of it. I am so sick of it.
It feels like they're dehumanizing you, right?
Yeah.
Okay. So let me ask you this question: when you feel that they're dehumanizing you, let's put that in a box. Okay, what people are doing to you, or what you feel that they're doing to you. When that's happening, how do you feel about yourself at those moments?
I feel low.
You feel low?
Yeah.
Okay. All right. What thoughts are running through your head when you feel low?
Should I even be here? Like, what's the purpose of me living?
Okay.
Like, why am I still here on this earth for people to make me feel better than I already feel myself?
Okay. Do you feel like hurting yourself right now?
Sometimes.
Right now?
Right now, talking to you? No.
Okay. Did you feel like hurting yourself? When you say sometimes that you feel like hurting yourself, is there ever like a plan? Do you have a plan together, or?
I'm getting a plan together.
You getting one together?
Yeah.
What is that? What's on that plan?
Yeah, I don't know. Maybe just unaliving myself.
Okay.
Because if people are going to continue to treat me a certain kind of way, what's my purpose here?
Okay, I get that. Marcus, like I said, you have been through a tremendous amount of pressures, a tremendous amount of things that, honestly, I'll be honest with you, that happen to a lot of Black people, right? And we have to take that in consideration. And saying that means that it is absolutely true. People can be judging you based on that. And people could be judging you at the CSU. But like I said, I want to put that into a box for a second. We're going to keep that in this little box. And then I want to deal with how you're feeling about yourself. And you're saying that it makes you feel low, like you want to unalive yourself. Have you thought about that today, unaliving yourself? No? Okay.
I just woke up.
Okay. So the second thing I want to ask you, one of the things that we're going to ask you a lot of questions. Did anybody, what diagnosis did you get from your time in and out of the crisis units or the psych units?
I don't know. Them people said something about schizoaffective something. I don't even know how to spell it.
Mm-hmm.
And they just said that. They said that's what it was, and then that's it.
Yeah.
So I don't know, but it was something to the sort of schizoaffective or
Schizoaffective disorder.
Yeah, I think that's what the people said.
So when you got that disorder, how did that make you feel?
It made me feel no kind of way because I don't know what it is.
Okay.
They just telling me that I got it.
Okay.
How am I supposed to make me feel?
I don't know. I'm wondering if it has anything to do with your anxiety or how you think that people might be seeing you and judging you.
I don't know, but can I get a check from it?
I think you can, depending on where you are. But we could get there. We can get to the point where you might be able to get a check. But what I would like to do is first to see if this diagnosis, has anybody ever went over it with you, and maybe could it be something that might be causing some of that anxiety? See, I suspect it isn't. It's not the only thing, but I'm wondering if it could be.
See, now you're about to piss me off because I told you that they never explained nothing to me. The people just said I had the whatever it's called, the schizoaffective, whatever it is. They just said it, and that was it.
Okay. Can I ask you, do you ever hear voices?
Before I did, I ain't hear nothing this morning because I just got up not too long ago. So
okay.
I hear nothing this morning.
Okay. So for when a lot of people get diagnosed in the units you've been in, they just give them the diagnosis and then they don't explain it, right? And then some people take those diagnoses and it does cause them anxiety. It does cause them to want to kind of it does cause them to feel low and cause them to want to just isolate, right, and be away from other people, because it is a big schizoaffective disorder. When they gave it to you, it is a big diagnosis. So one of the things I wanted to give you, because we touched on it, your diagnosis last time, and I wanted to give you just something to let you know here. And these papers just tells you what your diagnosis is, right? I want to let you know that your diagnosis is just like any other medical diagnosis. Like, say for instance, if you was diagnosed with diabetes, does that mean that your life can't be something that's good or acceptable or joyful or content or happy?
Yeah. Well,
do you think you can have diabetes and feel okay about yourself? Yeah. Just like if somebody said I had heart disease, right? It's a big diagnosis to have, and it could definitely cause anxiety, but you are not your diagnosis. So that's what I want to at least start on.